So as you guys are basically thinking about like investing in founders and how things that they're sort of really building, what's your macro sense of what you're seeing in the market? Like how are you sort of really thinking about like the next generation technology frameworks? How are you assessing the industry, and like what have been learnings from your vantage point?
Yeah, absolutely. I think great question, Abhinav. I think to just contextualize what you were saying, right? For example, if we look at the total administrative expenses, like $1 trillion plus, right? The total software revenue put together for every company out there is $250 billion, right? So just the massive opportunity, if people were to start unlocking this using AI and software, is just tremendous. There is no big healthcare IT company who's like $500 billion market cap or even $1 trillion market cap. What's the reason for that? Lots of inefficiencies and lack of interoperability and lack of clean data, a lot of reasons, right? I think what is for us, and I completely agree with you, the next 10 years are going to be fantastic for healthcare and healthcare software and healthcare AI. I think there are 2 or 3 things practitioners are just very, very focused on in our interactions with them, and that will unlock this opportunity. I think one is people are done with siloed systems. People are done with systems who are not taking a platform first approach. Mm-hmm. It has to be that. It has to be a place where you are able to connect and meaningfully across the entire care continuum, trying to figure out where sort of this data should be going, where should this workflow leading to, and so on and so forth. So that interoperability point is just very, very important. I think number 2, it's not about workflows as much as it is about the outcome. I think people are very focused on, okay, we'll build this workflow and then something will happen. I don't think people are talking about that. People want to see outcome, right? So I think in absence of that, it's just going to lead to, as an entrepreneur, you're not getting the sort of time with any of the practitioners, and also the technology not delivering to the promise it has. And the third point I would say is, I think people are looking for quick ROI, and it's not where it's going to be an 18-month implementation cycle. We'll see after 18 months if this technology...
Average EHR implementation is 6 years.
Exactly. And we were just talking about this, and for everyone, without naming names, one of the big health systems 20 years ago implemented EHR, spent $4 billion. The software vendor only got like 10% of it. Why? Because there were like tons and tons of implementation which is going on, in 6 years on an average, right? I mean, that's ridiculous. I don't think we have the patience or technology has time to wait for that much. So I think quick ROI as an entrepreneur, if you're talking to Banner, if you're talking to big health systems, you have to think about how can you prove that this is outcome-oriented, interoperable, quick ROI system. And then if that works, I think people are very hungry, and there's a very, very aggressive pull from the market and not a push anymore. So I think that excites us, and that's sort of those are the frameworks we are thinking about when we look at a young, exciting company.